Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
From seizures to diabetes to anxiety and beyond, there's a dog for that. Service dogs help people with a variety of medical conditions so their owners can live independently and enjoy life to the fullest. These dogs are loyal and loving care partners, always ready to assist. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today we talk about four-legged healthcare workers, and we'll even get to meet one. We'll be right back. Welcome back. I would like to introduce my first guest on today's show, Allie Cowan from Wind River Tales and Trails. Allie, welcome for our show.
Thank you.
Thanks so much for being here.
Thank you.
Can you just start out by talking a little bit first about your education, your background, and your experience with training these animals?
Absolutely. So I have a bachelor's degree in psychology with a research emphasis. So my focus during my studies was research in animal behavior, and so we were the people that were kind of sitting in the lab doing tests on rats rather than the ones that were taking emotional well-being charts in the clinical program. I actually started out as a wildlife biology student, wanting to work with wolves and other wild animals, and I actually adopted a husky from the Humane Society of Western Montana in Missoula. And he was an adult dog, he had lots of issues, and so we took a dog obedience class. And we did really well. We had a lot of fun, and I thought this would be a really cool job.
Yeah.
So I ended up switching my major from wildlife biology to psychology, getting my degree there, and then I also took a certification course through Animal Behavior College, which is a dog training certification course. And so I graduated from that program. They have a hands-on apprenticeship at the end. And then I started training privately while I was in college finishing my degree. I actually worked at PetSmart as a trainer for about a year and a half. And then I got on with Wind River Tales and Trails, which is kind of the supporting arm for the Wind River Bear Institute. And that organization uses dogs specially trained for wildlife conservation. So I started out working with those dogs and working with pet dogs, and service dogs is something I always wanted to do, so I kind of developed our own program.
Okay, and you train different kinds of service dogs, right? So can you tell a little bit about the difference between a service animal and an emotional support animal?
Absolutely. When service dogs first kind of became recognized as medically helpful and necessary, it was pretty easy to tell the difference because service dogs were pretty much for guide dogs for the blind, mobility assistance dogs for people in wheelchairs and other types of physical disabilities. But as they started recognizing the benefit for mental health and mental disabilities, that line became a little bit more gray. So there's two really big differences between an emotional support animal and like a psychiatric service dog. An emotional support animal is really just a pet. They just are trained, or they're just there for companionship and comfort. They don't really do anything.
Okay.
They are exempt from housing restrictions. So like if you live in an area or in an apartment or a house that doesn't allow pets, they don't apply to that rule, but they don't have the same ability to accompany their handler in all places like a service dog does. The main difference is that a service dog is trained to perform a specific task that mitigates the handler's disability. So they have extensive training not only to behave in public, but they also have a very specific thing they do to help their handler. So the big differences between an emotional support animal and a service dog are first that the owner has to have a disability. Some people with emotional support animals have a mental condition, like depression or anxiety or something like that, but it's not debilitating enough to be considered disabling. So that's one of the primary differences, and then the other is the training.
Okay, and so you talked about that the person has to have a disability. So what are some of the different things that these service dogs will do? What are their jobs, I guess?
Absolutely. So there's the one that most people know about, which is guide dog. So they guide a person who's blind. There are mobility assistance dogs. So those are dogs that assist somebody in a wheelchair or somebody that has another physical disability that prevents them from kind of performing everyday activities like opening and closing doors, picking up objects that they've dropped. You also have dogs that help provide kind of momentum and balance assistance for people that have balance issues, or they have an issue with like one side of their body, something like that. And then there are ones that people don't know as much about. So there are dogs that can alert to high and low blood sugar for people with diabetes. There are dogs that can respond in the event of a seizure. There are some dogs that can even predict seizures, although that's not something you can train. And then there are also dogs that help with psychiatric disabilities. So dogs that help people with PTSD. And panic disorder by kind of mitigating some of the triggers that cause those panic attacks. They can create space for their handlers in a non-aggressive way. Service dogs can't be aggressive. So they can create space. They can also alert their owner to an oncoming panic attack or anxiety attack so that they can get somewhere safe before that happens.
Okay, so you talked a little bit about the seizures, and that's what we're going to talk more about today. So there are dogs that can predict seizures. How do they do that?
Nobody really knows for sure. They think that it has something to do with chemical changes in the body that the dog's picking up by scent, but there is currently no definitive way to test for that ability in a dog and no definitive way to train for it. Either a dog has that ability or it does not.
Okay.
Katie, who we're going to talk to today, I'm sure you probably have a follow-up question on that, has never demonstrated that ability, so she is trained as a seizure response dog.
Okay, and you mentioned diabetes as well. How do dogs sense if somebody has low blood sugar?
That one is a lot better understood. That one is definitely scent-based training. So the dog is picking up changes in the ketones in somebody's breath. So they smell the person's breath, they smell their sweat, their saliva, and they can actually detect those changes. And we train them very similar to the way that you would train like a bomb sniffer dog or a drug sniffer dog. So very, very similar.
Wow, okay, and so is it a certain breed that has that ability, or can any dog smell someone's breath like that?
Almost any dog can do that and make that detection. The difference between dogs that can be trained to do this and dogs that can't are how much desire they have to work. Because if they don't have any desire to work for a sort of reward that follows detection of that scent, then they're not going to alert their owners. Because they don't have any reason to, they don't care. So the big difference is that dogs have a drive and a desire to please and to earn a reward, which kind of makes that ability there or not.
Okay, and so just one last question really quickly before we take a break. Can someone watching at home get their dog trained to help them if they have some sort of condition where they need that service?
Absolutely. One of the biggest differences between our program and a lot of the bigger organizations out there is that we want to make service dogs accessible to those who need them. We recognize that people that have, a severe or serious disability don't always have a lot of resources because they're putting them towards their health.
Right.
And so we want to make service dogs accessible as far as being affordable and as far as getting the dog goes. So for us, we actually use shelter dogs and rescue dogs that are present in the shelters that we run through a temperament assessment to make sure they have the ability to do the job, and then we help owners train them.
Okay.
And then we can also use a dog that somebody already has as long as they have the right temperament to do it.
Okay, that's great. Thank you. We do need to take a quick break, but coming up next, we'll not only meet one of these remarkable dogs, but also someone who benefits from her training and medical assistance, and learn firsthand what these dogs mean to people who need them right after this. Welcome back to Healthy Living for Life. Allie Cowan is still with us, but we are now joined by Janelle Mostad and her dog, Katie. So we're going to talk to Janelle here in just a minute, but Allie, before we do, can you start out by just giving us an idea of how long it takes to train a dog like Katie?
Absolutely. A lot of the bigger service dog organizations that breed and raise and train their own dogs, that training can take place over the course of 18 to 24 months because you have to wait for the dog to grow up. With our program, we actually start with young adult dogs between about 1 and 3 years old. So we're starting with a dog that's mentally mature enough to work. So our training can take anywhere from 3 to 8 months, depending on the extent of the training. Katie's took about 4.5.
Okay, and Katie is a service dog.
Yes.
And I know we see signs that say service dogs welcome or service dogs only, something like that. Are there laws about where these dogs can and cannot go?
Absolutely. So service dogs are allowed to accompany their handler anywhere that the general public is allowed to go.
Okay.
Even those places that have health code restrictions like restaurants and that kind of thing, because they're considered a piece of medical equipment and considered medically necessary for their handler.
Okay.
So that is not true of emotional support animals like we were talking about earlier. So that's a big distinguishing factor between service dogs.
Okay, great, good to know. And so Janelle, you got Katie for a medical condition that you have. Can you just tell us a little bit about your medical condition?
Yeah, so I have epilepsy. What happened was I was in an accident and got a TBI or a head bleed. And out of that, I developed epilepsy. So Katie helps me with seizures, which is awesome.
And yeah, awesome. So how do these seizures impact your life?
So when I first was diagnosed with them, it's hard. My husband works all day, so I'm alone during the day.
Okay.
So what would happen is if I got an aura, which I always thought was colors and things like that, but mine presents a little differently. I would text my husband and tell him, hey, I'm getting an aura. I'm going to take my medication, my rescue medication. And he'd just say, okay, great, text me if it gets worse. Well, by that time, how would he know? Because I would just end up having the seizure, and there's no one to alert him, there's no one to help me. So it was a little scary for him and my family.
Sure.
They just would never know.
Mm-hmm. And how often do you have them?
Now I have them maybe once or twice a month,
Okay.
3 times max, but at the beginning I would have 3 or 4 a day,
Okay.
every day.
And you got Katie to be a service animal for you.
Yeah.
And so did you have her before you started having seizures, or you got her afterwards?
After.
Okay.
Yeah, we got her from a breeder specifically though, when she was a puppy, specifically for that.
Okay, and what kind of dog is she?
She's a German Shepherd.
All right.
pretty
And
small.
so, Allie, is that pretty common, German Shepherds to be service animals, or is that a typical breeder? What kind of breeds do you usually work with?
Because we rescue from shelters, we work with a lot of mixed breeds. Katie's actually one of the only purebred dogs that we've worked with recently.
Oh, okay.
But German Shepherds are very popular as service dogs because they are incredibly smart. They can learn almost anything you want to teach them. And they have a very high drive to work. They've been bred to work really closely with their owners. A lot of the bigger organizations are moving towards like Labradors, Golden Retrievers, because they have a lot of those same traits. One of the downsides to a German Shepherd is that they can be protective. And so one of the things that we look for in a dog that we're screening is kind of lack of that protective instinct. Because if emergency medical personnel need to be able to access Janelle, Katie can't protect her.
Okay.
So that's one of the downsides, but yeah, they're very, very common.
Is the size of the dog taken into consideration? Do you generally need to work with larger breeds?
Not always. I actually have a diabetic alert dog that I work with that is a little poodle terrier cross. He's only about 10 or 15 pounds, but he's for a 10-year-old boy. And so that's perfect because he feels very safe with that dog.
Okay.
Large dogs we use if it's necessary for a particular task, like a mobility dog, if we're working with somebody who needs the dog to pull a wheelchair. But otherwise, no, the size isn't important.
Okay, but you did talk about traits. So can you talk a little bit about what traits are important for service dogs?
Absolutely. Service dogs have to be friendly. They have to get along well with humans and other dogs because they can't be aggressive in public. They can't be overly fearful. When I'm working with a new client and I talk to them about the type of dog we're looking for to match them with, I tell them that they need to look for the Goldilocks dog. We need to look for the dog that's not too hyper, but not too laid back. We need to look for the dog that's not too friendly and over the top about seeing people, but also not one that's timid. So we look for that nice, easygoing dog that fits right in the middle.
And you said it took about 4 months to train Katie, 4.5 months?
When Katie was staying with us, it did. Janelle and Katie actually took our puppy class when Katie was a baby.
Okay.
And training doesn't really stop. So right now, Katie and Janelle have been together for about a month post-graduation, but we still meet. We still meet and make sure that the training is going well, and they still have some time to kind of get their relationship really strong and going. So it's seamless and it works really well every day.
Yeah.
So it keeps going even past the point where she goes home.
Okay, so can you talk a little bit about the training? What did you do with Katie?
Absolutely. I've said that a lot, I'm sorry.
You're fine.
So with Katie, we have with all of our service dogs, we have 3 parts to our program. We have basic training, which is where dogs need to learn all of those foundation commands that all dogs should learn. Sit, down, come, stay, all of that, how to walk on a leash. And once a dog gets past that point, we actually put them through the AKC's Canine Good Citizen Test, which is an obedience test. It's an obedience title that teaches them, or that shows that they can perform all of these basic commands to a basic level. And then we do what's called public access training, which is where the dog learns to do all of those things that a service dog has to do in public. So how to be under a table at a restaurant, and how to ride on public transport, and how to do all of those things. And then the final piece of training is the specific task training that she needed to help Janelle. So those were kind of the 3 phases, and we reassess at each phase.
Okay, great. So we do need to take another break, but Allie, Janelle, and Katie are going to stick around, so we hope you will too. Stay tuned to learn more about how Katie helps Janelle every day. We'll be right back. Welcome back. We're learning about how Janelle Mostad's medical dog Katie helps her each and every day with her health, specifically with seizures. So thank you, Allie and Janelle, for sticking around with us. So Janelle, I'm going to start with you this time. Can you tell us a little bit about what exactly Katie does to help you?
Yeah, sure. At times when I'm tired, I get a little off balance. So Katie actually can help me stay balanced. She has a handle. So what I do is tell her, whoa, Katie, wait. And then I grab the handle and can tell her forward. And she allows or helps me with that counterbalance, which is super helpful and helps me walk in a straight line.
Okay.
So that's always good.
Yeah. So that happens before you have a seizure, you get wobbly?
Yeah, sometimes before a seizure, definitely after.
Okay.
Definitely after. Just when I'm tired a lot as well.
So what does she do for you when you actually have a seizure?
Oh, that's a great question. So when I have a seizure, often collapse. So she's able to roll me over onto my side and then lay back behind me. So I'm not on my back. That just allows, like with, secretions and stuff like that. That way I continue to breathe. And it keeps me safe during that time as well. So I'm not just rolling around on the ground. She's right there to help.
Okay, great. And so, Allie, can you just walk us through a little bit then? I mean, Janelle just kind of talked about what Katie did. How did you go about training her to know that that's what she was supposed to do when Janelle had a seizure?
It's a really good question, and the way that we started with Katie is that we treated it like a game. Katie loves to play tug of war. And so initially we had thought that we were going to teach Katie to actually push Janelle over, but if you look at Katie, she's not a very big dog. Very small for a German Shepherd, and so we decided to switch that to being able to pull her over. So Katie's got a very special leash that actually sits over over Janelle's chest, kind of like a purse. And so in the event of a medical emergency, Katie's always got a handle that she can grab and pull her onto her side and then move around to her back and lay down. So the second part of that, we taught her to anticipate a big reward. She loves to play Frisbee. And she loves to play fetch. So the only way she got her Frisbee thrown for her is if she hit that correct position.
And so different dogs probably have different rewards then?
Absolutely.
Yeah.
So we played to Katie's strengths. And made her want to do this job and think it was the best thing in the world. So to Katie, it's kind of a game.
Great. And so there's probably lots of people at home who think it's awesome that you can get a dog and then train a dog to be a medical service animal like Katie. But what about those people who just see a service dog out and about? Are people supposed to pet those dogs? How should you act if you see a service dog in the public?
The general rule of thumb, because service dogs are actually considered pieces of medical equipment, I know that sounds really harsh, but they are, is you should treat them like they're not there. You should think of a service dog the same way that you would think of a wheelchair. You would approach a person and talk to the person, not to the dog. Now, we also recognize that dogs are living, breathing animals, and you might be curious about that dog, and that's okay. You're welcome to approach the person with the service dog and ask them, but definitely talk to the person. Okay. Don't talk to the dog, and always ask permission if you want to interact with that dog.
Okay, and so Janelle, what do you do if somebody approaches you or tries to pet your dog or asks if they can pet your dog? What's your preference and how do you handle those situations?
For me, I just tell them, I thank you for asking, but right now she's working. Katie's young, and so she gets distracted really easily. So, but always, thank you so much for asking. It's heartbreaking to tell little kids. It's heartbreaking. I'm sorry.
Yeah.
You can't pet her, but thank you for asking. But I just prefer that. That way she doesn't have a squirrel moment.
Sure. And so Allie did talk a little bit about that these service dogs are allowed into businesses, but are there things that people should know, especially business owners, about how to handle a service dog coming into their organization or their business?
Yeah. They're allowed to ask like 2 questions. What does your dog provide for you? And that, well, I guess I'll just go off the first one. I like to be asked that, but I think business owners don't understand the rights that they have, and the trainer or what have you, the partner to the dog.
The handler.
The handler, thank you, should be able to give those, and at least 3. So when I'm asked, which I have been before, I was really impressed, and the way it was presented to me was very respectful. And I have no problem answering that question. In fact, I really am annoyed when like someone slaps on a little vest of their Chihuahua and I'm walking past and it's like trying to eat Katie, but they consider it like, this is my service dog. I don't think so.
Yeah.
I don't like that because we've worked hard to get her to where she's at, and it takes a lot of training, and it's disrespectful, I think. So I have no problem, like as a business owner, ask me.
Okay.
So just to recap really quickly, the 2 questions are, is that dog a service dog? And what tasks is that dog trained to perform?
Okay.
And those are the 2 questions that a business owner can ask.
Okay, and I know you talked earlier too about there's a difference between a service dog or a medical dog and a psychiatric assistance dog. So is there different things that those animals can do in public versus a medical dog?
So a psychiatric service dog or assistance dog is still considered a service dog. They still perform a task. An emotional support animal is the type of dog that's often confused with a psychiatric service dog. And those type of dogs don't have any training, so they do not have the same ability to accompany their handler. They cannot go anywhere that pets are normally not allowed to go, because they haven't received the training to be able to behave in public. And businesses don't have to accept a dog onto their premises that is disruptive, aggressive, or not potty trained.
Okay.
So those are the times that somebody can legitimately be asked to leave.
Okay, and so that's where those questions come into play about, is your dog a service dog? Okay,
Yep, you
great,
got it.
Perfect. All right, ladies, thank you so much for being here. It was great to meet both of you and to meet Katie, and we learned a lot. I would like to thank Allie and Janelle for being on our show today, and of course Katie too, and thank you for joining us this week. We hope you enjoyed the show, and we'll come back again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. We'll see you next week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.